deals with the gastrointestinal tract and hepatobiliary diseases as well, like say biliary atresia, choledochal cyst are covered in that one. Oncosurgery, we provide services for oncological surgeries, tumors anywhere in the body except in the brain, and certain complex thoracic surgeries are dealt by a thoracic surgeon and neurosurgeon. We deal with several of the oncosurgeries, especially the renal and suprarenal tumors like Wilms tumor and neuroblastomas, and rhabdomyosarcomas as well. And neonatal surgery, we comprehensively cover majority of the neonatal surgeries anywhere in the body, again apart from neurosurgical and cardiac surgical cases. We have a neurosurgeon, excellently skilled, who is able to manage all the neurosurgical problems in the newborn as well. And fetal surgery, yes, we are doing fetal surgery as well. We collaborate with the fetal medicine unit, and we do antenatal diagnosis and treatment planning, and then we deliver high quality care to all these babies, complex babies with serious congenital problems. And we have produced immensely great results for some of the babies who are operated here with us. Okay. Yeah, so we provide all elective surgeries, complex surgeries, and 24/7 we cover emergency surgeries. And apart from that, we do laparoscopic surgeries and video-assisted thoracic surgery as well. And we are proud to say that soon we will be doing robotic surgeries as well. Okay, it's not very far away, it's very near. Yeah. And some of our accomplishments to highlight that are notable are congenital diaphragmatic hernia surgery was done on a baby who was born with complete diaphragmatic agenesis, and the child could not be transferred to the operation theater. Child needed operation in NICU as only. The child was on high frequency ventilator, and child was operated on while on 100% oxygen in NICU itself. The child is doing very well and ready to be discharged. And spina bifida surgery was done in NICU as well. Okay. And laparoscopic repair of ovarian torsion. Baby was born with bilateral torsion of the ovaries, hemorrhagic, and then we have done that surgery in newborn baby of, I think, 2 days old baby. And total pancreatectomy subsequent to laparoscopic partial pancreatectomy in a newborn. The child had severe hypoglycemia because of islet cell hyperplasia, diffuse variety. So laparoscopic surgery was done for this baby, which was a great achievement. And thoracotomy and lobectomy. 2 kg old baby boy was born with severe respiratory distress, and he needed immediate urgent thoracotomy and lobectomy. So it was incredibly difficult surgery, but child is doing very well and recovering greatly. Yeah, to tell you a little more about long gap esophageal atresia, esophageal surgeries, like which is one of the difficult surgeries to do in newborn. The gap was nearly 4.5 centimeter, so we waited for the baby to grow, and then we have done delayed primary repair, and child has recovered very well and ready to be discharged. So those are some of the wonderful surgeries that we have done, and the scope of surgeries we deal with all urological, gastrointestinal, and neurosurgical, fetal, thoracoscopic, and laparoscopic surgeries as well. So I end here with this and hand over to Dr. Iviano to carry on.
Thank you, Raj. Can you hear me? So I was hoping actually that Raj would leave his last slide up because I wanted to make a point. The point I wanted to make is this. Neonatology, or NICU, is the center of the universe. Accept it from me. But don't just take my word for it. The reason why it is this. Every single child starts off as a baby. Every single child that goes on to an adult will have started off as a baby. So that's why I jokingly say neonatology is the absolute center of the universe. But joking aside, it's a delight for me to be here today. I'm part of a double act. That's why you see two names there. My colleague is not here today, Dr. Musadak. So there are two consultants in our service at BMC. The interesting thing about both of us is that we trained in two different places. So I'm UK trained, and Dr. Musadak is US trained. But that's okay. I don't hold that against him, and somehow we managed to relate appropriately and run a service. And this is a service that we want people to understand that we run. So we run a neonatal service for, So first and foremost, we run a neonatal service for all newborns. This is the first thing to bear in mind. Not all of our babies are ill. The vast majority of our babies are quite well, but we're still obliged to see them as part of the newborn service. So every single baby gets attention from us. Most of them are absolutely fine, and they go to their parents. Some babies, maybe 10, 15% of them, will require our care, probably usually in the region of about 15%. Those babies come to the NICU, and we look after them there. Subsequently, we follow them up in the neonatal clinic, and my colleague, Dr. Lamya, is here, and she's part of our neonatal developmental center service, so that when we send these babies home, whether they've been ill or not, they can be followed up for developmental care. As I said, there are two of us, UK that side, US this side, still managing to work together. We've worked very closely with a whole host of different multi-specialty colleagues to manage different sorts of cases. So they're the typical cases that people think about with NICU, which is the extreme preterm baby. Actually, these babies don't necessarily make up a huge proportion of our cases. Currently, as I speak, in the last 4 to 6 months, between 50 and 70% of our cases have been complex surgical cases referred to us from all around the UAE. So this is a unique product that we provide, or unique service that we provide with the help of Dr. Raj and our PICU consultants as well, along with our other multi-specialty colleagues. So if you take a look, you'll see that we've carried out various neurosurgical cases, including, of course, in utero. We have an in utero program as well, currently purely for spina bifida, which Dr. Raj is part of as well. We've had a very interesting recent case of a near total pancreatectomy in a neonate. You will barely see this sort of thing happening. It really happens, and we try to avoid it, to be fair, but eventually we were obliged to do that. The other thing that we are very proud of is that we have the capability within our system to carry out complicated surgery within the neonatal intensive care environment. This is not often done for various reasons. It's not something that we necessarily want to always do, but it's something that we have the ability to do if we need to. So we had a case of congenital diaphragmatic hernia who was too unstable, we felt, to move to theatre. And so we carried out the surgery on the neonatal intensive care unit, and it was successful. So thanks to our anesthesia colleagues and the willingness of our nursing staff as well to support that procedure. Dr. Kesava has already mentioned the list of different subspecialists that we have. I don't think we've missed any out. If we have, I apologize. But we have a very large number of subspecialists. This is a major strength for us, because the important thing about this is that they're all under one roof. So if you're in BMC, you will have access to these individuals very readily. If you're within the Burjeel Holdings network, you will still have access to these individuals, if not necessarily immediately, but at some point expeditiously in relation to your needs. So I won't go through all of this, but it's just a rough list of the sort of services that we provide that I may or may not have mentioned. I think something that Dr. Kesava didn't necessarily mention was ECMO. Did you mention ECMO? You did. And this is something that I think that we are well placed to provide because of the extent of our subspecialty coverage. If you're going to do something like ECMO, which is very high risk, then I think you want as many different subspecialists around as possible. So we're part of a network, and I want to stress this. BMC is the center of a network, and that network is Burjeel Holdings. We provide services for the babies who are sent to us directly from within our hospital. We provide services for babies who are referred to us from within Burjeel Holdings, and of course, babies who are referred to us from outside of Burjeel Holdings as well. We know that training and data are key, We have here today with us our perinatal data manager, and we're very proud of that, because we think that if you don't keep track of your data, then you're not sure how you're progressing and how you want to improve. So I think this slide is an important slide. It just highlights what we've been talking about. Maybe Dr. Kesava would rather have PICU here, but so NICU, we essentially feed out and get support from all of these services. And again, I'd like to highlight what Dr. Kesava said. We have an excellent neurodevelopmental and rehabilitation service, which is a centralized service as well. It's not necessarily always available. The additional advantage we have is that our babies have access to these services as an inpatient service as a standard. So every baby on the NICU will be seen by someone from the to make sure that, that they have no requirements whilst they're in, and once they're discharged, then they get follow-up as well. So with that, I think that's my last slide. Thank you very much for listening. Yeah, thank you.
Thank you so much, Dr. Eviano. That really highlighted our multidisciplinary care we provide and the strength of our team. So I'm Dr. Ghulam. I'm pediatric pulmonologist at Burjeel Medical City. And I think just carrying on, I trained in UK and Ireland for almost 20 years, all my basic pediatric training, pediatric pulmonology training. I was lucky to work in Great Ormond Street Hospital, one of the best pediatric center in the world, and you know, carried on towards the end. And then for nearly 6 years, I was a consultant in Manchester, where I was clinical lead. And some of the rare aspects of pediatric pulmonology, like interstitial lung disease, cystic fibrosis, complex care, I've had huge experience with. Today, I would just highlight for over the last 1.5 years, what we have achieved in pediatric pulmonology, how we are going forward. So, at Burjeel Medical City, we are breathtaking. I mean, from the services we provide to the facilities we have, really cater, and every day we strive to get better at how we can improve the patient experience, patient care in every aspect, from outpatient to inpatient. So, in terms of the conditions, there is a long list of things we do, and I look after particularly along with my other colleagues. But I have particular experience with the, chronic cough, asthma, recurrent chest infection, and we know in United Arab Emirates there's about 10 to 12% incidence of asthma and recurrent wheeze, and particularly younger children, it's fairly common, and there is a lot of morbidity associated with it. So we manage this all, recurrent infections, bronchiectasis, and the list goes on. And I have particular experience in interstitial lung disease and cystic fibrosis. We recently started our sleep lab for last 3 months, and it's up and running for pediatric cases. And already we have diagnosed some very severe obstructive sleep apnea, and we have on the pathway to treatment with our ENT colleagues, and we have some complex patients with the trachea-ventilated complicated lung infections we have managed with the support of our intensive care and general pediatric colleagues and ID team. We have full-fledged services really from pediatric pulmonology point of view. All the diagnostic and therapeutic in quick clinic visit, we can actually do simple things like spirometry, bronchodilator reversibility, axial nitric oxide, exercise testing, within half an hour to 1 hour appointment, and we can have a diagnosis and treatment plan started. To other things like, where smaller number of children may need airway endoscopy to assess for further diagnostics. So we have the capability to do it in the theater. We have capability ability to assess the airway with ENT, and particularly in younger children, it's very, very important. And we provide the best quality of care that we do it in one setting where the child avoids 2 general anesthetics. And we have all sort of imaging needed according to the child's need, and sometimes they need sedation or general anesthetic, and we can provide that as well. And really, I'm really proud of working with the team. It's the team which makes a difference, and no pediatric subspecialty can work on its own. And my colleagues have already highlighted, and every individual member in the team is really, really important. And the sort of care we strive for is actually like, all the subspecialties mentioned, and, probably even more, and every day, the complex cases we see are part of the team. And this photo on the top is part of our, aerodigestive clinic. And this one has been really great success because our patients, they come to one clinic, they see all the specialists, they see all the multidisciplinary dietitians, and they particularly the speech and language. And for parents, for these complex patients, some of them coming to the clinic is a big deal. They're coming in an ambulance, they have ventilators with them, so they are really happy to see us in one clinic rather than going to multiple clinics in multiple floors. So this has been a huge success, and with the pediatric neurology on board now as well, we will have more kind of complexity of these cases and better care. And just to kind of, show the sort of stuff in terms of the bronchoscopy, this patient has had really, really thick mucus, and these sort of things you cannot pick up without having a good services with the bronchoscopy. And this is another example of our partnership. This is a child who has had a foreign body in his airway for many days. Before he was referred and to me, and then with the partnership with our ENT colleague, within 6 hours of arriving to us, we retrieved the foreign body and the child was stabilized. And here just is the glimpse of the team involved, like the teamwork. From the point the child arrives, the communication, ensuring that everything is done in place, communication with the theater, and subsequent care. So we have the capability, we have the facilities, we have the staff, we have the equipment, and it's great. It's great because we make a difference in children's lives. And, just another example of a child having long-term cough and treated for many, many months. And once they come in, and you can see the lavage, which is all the phlegm removing, and sometimes it has therapeutic effect as well as the diagnostic, so we can offer that. And airway clearance, had a huge experience around this area while working in UK, and we have established the airway clearance in our service. We have all sorts of, from younger children to older children, working closely with our physiotherapists and building the service more and more. And this is really fascinating because it's again making a huge difference in these children's lives. And lastly, I would say it's the teamwork here on the right side. This is some of the physiologists who are actually doing the sleep studies. We have a happy team. They're really good. They're coordinating with us very well. One of the NICU baby, I can see Dr. Eviano smiling there. He was extremely premature, and all the good work the NICU team has done, and then continued on to the clinic, and he's doing fantastic. And World Asthma Day, we recently celebrated. We are also doing lots of education stuff, awareness, and improving the quality of life for children. And that's me. Thank you so much.
That's a lot of you. Thank you very much. Nice presentations, by the way, all of you. Can't beat you with all of those pictures you put on. I'm Dr. Lamya. I think most of you knows me already. I recently joined BMC family, I would say, as a pediatric neurologist. And I hope that I'll be adding a value for such a wonderful and big team. I'm so happy to have all of these subspecialties in under one umbrella. So, as I say, I just have started now recently. So BMC as a leading health provider actually is provide yes. It's providing lots of pediatric subspecialties because they have almost all of the pediatric subspecialties that are capable of dealing with multiple complex cases, and such subspecialties are not available in lots of medical care facilities here in Abu Dhabi. So, as I said, those subspecialties are not all available, and the subspecialties which is here are capable of taking care of all cases, either it's simple or complex cases. I started with hoping to start a pediatric neurology service that is leading the pediatric neurology care in this, not only in this region, but also to go probably internationally. So the mission is not only to establish or to deliver exceptional pediatric neurological care that satisfies not only the physicians, but also satisfying the people and satisfying the patients as well. Establishing a pediatric neuro centers that is capable of by setting a new standards in this region with such a broad scope of service that we can provide. And by talking about the service that I can provide, actually, I would like to talk a little bit about the scope of neurology, which most of you probably know about it, and you have talked already about it in your presentation. So here is some of the services in the outpatient. We are capable of treating cases like epilepsy or intractable epilepsy. And as you know that most of the cases, or about maybe 45 or up to, sometimes I would say up to 70% of the cases are having either intractable epilepsy, where the reason is for that is genetic or lesional. Other services that we can provide is treating the headache, post-traumatic concussions, developmental delay, and behavioral disorders. And as a new also, I would say, neuro-oncology. Since we have established the BMT unit here, and there is lots of neuro-oncological cases in this facility, so we can provide also the service for such cases. As an inpatient, we are obliged to fulfill the need of the inpatients, consultations, whether this is starting from status epilepticus or altered mental status. I would include also the neuro, autoimmune neuro, that we are capable of managing them with the help of plasma exchange, which is a unique service provided by the PICU. There are, with PICU is a crucial here, and NICU also in ICU, and providing consultation for those two units and collaboration to provide the best health care for the patients post-discharge as well. Let me brief you about the diagnostic and the treatment services. We have a specialized team that in treating conditions, as I said, the epilepsy and cerebral palsy, and we have a unique service dedicated and experts actually in reading and interpreting the electroencephalogram or the nerve conduction and evoked potential studies. A unique service will be added soon by adding the epilepsy monitoring unit, that will provide the diagnostic for patients with intractable epilepsy, and hoping to start a complete epilepsy program along with neurodevelopment service is becoming very popular because we have so many patients here having either autistic patients who will need evaluation and evaluation and as well as treatment. And I must say that we have the experts who are capable of, along with the rehabilitation team, capable of providing such a service. We added with Dr. Ayman Hattab the neurogenetic, and this is a unique service to have a neurogenetic consultations in one facility. This slide I take it from the rehabilitation with the number of the patient they have seen, and this is a state-of-art service. They have multiple patients, and they are providing an excellent rehabilitation therapy, occupational physiotherapy, speech, behavioral as well. I got this picture also from the first MDT meeting, which was conducted, and multidisciplinary meeting, which is conducted with such a lovely team from the ortho and the rehabilitation team to start. It's a good start, and hoping that we'll be able to conduct by adding also the cerebral palsy program. And you will see more meetings like this and more discussion by after recruiting multiple patients to this program. So the aim is in pediatric neurology, establishing the pediatric neurology service. It's not only to strengthen the relationship with the pediatricians and also with other health care providers. So they will, and also to provide them the best service. But also we are planning to participate in the community by multiple events and increase the awareness among the people about what pediatric neurology service can provide them and how we can help them to improve their life, not only the parents' life or the family life, first of all the child life, and also then consequently for the whole of the family life. So thank you very much. I don't have much to say here. We just started. Hoping next year I will have many cases to show up, and with your help and with your support, then probably we'll form a good team. Thank you. Nobody will talk. You want to add something?
I wanted to show this in the last slide in my presentation. I think Burjeel Medical City is a one-stop service for children from fetal life to adulthood. So we have a very comprehensive pediatric program, and I would like to invite everyone to use our capacity and our facility. And yeah, thank you.
Thank you very much, Dr. Kesava. Is there any question from the audience? Please do raise your hand and I'll bring the microphone over to you. I believe not. So I think that concludes the discussion. Thank you very much to Dr. Kesava, Dr. Rajashekar, and Dr. Viano, Dr. Ghulam, as well as Dr. Lamya. Thank you very much for speaking to us today. Thank you. And that concludes the talks here at Burjeel Medical City. We hope you have a great rest of the Abu Dhabi Global Healthcare Week, and do stick around for some photo opportunities.